Mahmee is a care coordination platform that is designed to ensure access to care for all moms and babies. So our mission is equitable access to care. We believe in introducing a comprehensive care model and really one that is designed to support moms with the care that's needed when they need it, ultimately reducing preventable deaths and injuries. And we do this through a collaborative care technology that automates care delivery processes, eliminates room for bias, and keeps the entire care team up to date. So what does that actually look like? We can imagine it's, we call it the healthcare stack, and the base layer of this stack is the care coordination software platform that we've designed that functions like the glue or the plumbing that connects together the various aspects of the prenatal and postpartum experience, and specifically the providers, both the physicians and non-physician specialists that are working across the continuum of care from conception through baby's first birthday. That base layer of care coordination tools is a suite of modular tools that are designed to connect patients, providers, and allied health professionals together to boost communication and automate coordination workflows. And it really is a modular set of components such that the technology is designed for very specific connecting up of the various providers and care programs, and even the technology and devices that are being used across the maternity care spectrum. So if there are components that you already have in your care ecosystem that you're utilizing for remote patient monitoring, for communication, for digital charting or telehealth, then the care coordination products that Mahmee has designed can be a complement to those resources. But many of the Medicaid organizations we work with are actually lacking a lot of these kinds of tools. And so a more robust implementation of that care coordination software may be needed in that case. Layering on top of that, because technology is only one piece of the puzzle, are the fee-for-service and value-based care programs that Mahmee designs and implements to ensure access to care across an entire maternity population. And this is leveraged through the Mahmee network, which is the broad, the national spread of providers that are using Mahmee care coordination software across the country. And so you're able to expand your service capacity to provide care to every mom and baby, thus reducing risk and increasing revenue. So can think about it in this regard. When we work with organizations of all types, and our fastest growing market is actually Medicaid-oriented organizations, we are generally assessing whether or not an organization has the service capacity, the operational capacity to deliver comprehensive maternal and infant care to its entire patient population. And if so, if you have the people you need, then what might be missing are the tools to connect them together, in which case the care coordination software platform may be that missing component. But what we find is often that once you start to build out a technology implementation to connect those providers and patients together, you find that there are actually gaps in the care programs you want to design. And so the way that Mahmee is designed allows for layering of care programs on top of that care coordination platform over time as the providers and the health system administrators in your organization start to identify opportunities to expand service lines and to expand care coordination programming. So we're going to break this down into the base layer, that care coordination software. The way that this functions is that we're centralizing mom and baby's medical records and the entire care team. We're able to link that care team up together across practice and across health systems. So regardless of where those care team members are, they are centralized and able to communicate and collaborate through Mahmee technology. We as a company are proactively engaging with patients and engaging their providers in next steps of care. So we do that through a variety of care coordination protocols, which are designed holistically across the Mahmee ecosystem, but also can be specifically customized for that particular implementation for that health system. And then finally, we're flagging high-risk patients and keeping the whole care team up to date. Again, the protocols that were used are a combination of standard protocols designed to be used across the entire Mahmee ecosystem, but then can also be customized for a particular patient population or health system. And those protocols can also leverage the current tech implementations that are in place, including, again, IoT devices, other remote monitoring programs, other communication tools or educational resources that are in place. So it's aggregating that information and looking holistically at how to provide care management at scale to that entire population. A couple of things to note here in the way that the care coordination platform functions, there's a personalized patient experience. There's a portal that is accessible from any device. There's no download needed. It's a web-based platform that allows patients to access their care tools, their visit summaries, and their communication with providers, again, across practice and across health system from anywhere. Cross-practice collaboration is possible because rather than what we've seen with traditional EHR and care communication or care coordination software, which really is designed sort of like walled gardens, where each health system only has their own implementation that they can work within. Mahmee is sort of it's a national ecosystem that allows for ties to be established and associations or alliances to be established across the community and across the platform. Telehealth tools are available for one-to-one communication. So if you do need video conferencing or phone call software through the platform, that's available. And also group communication is possible as well, which can be used in a support group or class format, or also for multi-provider consults and translation services. Automated care coordination. This is what's powering the entire platform. So bringing all that information together and centralizing the health record plus the care team allows for routing of information very quickly to prompt action either on the provider or patient side. And then risk tracking and escalation. This is where sort of the back office of Mahmee operations happens, where there is a team of clinicians and support staff internally in our company that are providing additional support and oversight to ensure that physician escalation happens as promptly as possible. An example of an implementation here is our work with LA County Department of Health Services, the second largest municipal health system in the country. In this case, they have hundreds of providers, both physicians and non-physician care providers that are working within the OBGYN organization for the County of Los Angeles. And so this is an example of, we've got the people, but we need the tools. They were able to introduce telehealth capabilities for their physician and non-physician staff, multi-language patient portals for articles, videos, and visit summaries. And then finally, what the end result was here is care plan visibility between the physicians, mental health service providers, which are in a completely different aspect or part of the organization of the county, which is Department of Mental Health, doulas that are part of a county-funded program in, again, a different organization entirely, the Department of Public Health, and then a Strong Start program that's funded by CMS. Again, all of these providers are working with the same patient population, the same safety net group of 3,000 to 4,000 prenatal patients a year across the county, but by using Mahmee Care Coordination software, they're able to continue to use their own technology within their department, but also bring that information together to communicate across those platforms. Now, once that technology implementation occurs, the fee-for-service and value-based programs can be layered on top. And we have this kind of flexibility because we know that although the ultimate goal is to get toward bundled value-based care programs, fee-for-service is still alive and well in maternity care, and it's been a challenge to move toward value-based care, especially because it's very difficult to link up these different providers across different care ecosystems currently. So Mahmee's solving for that. Once the care coordination software is implemented, you can enhance a current service line, design a new care program, bundle prenatal and postpartum services together, and track clinical outcomes and patient engagement in one place. So being able to not just aggregate the data, but actually really aggregate the care team allows for value-based programs to come to life. And here's an example of that. We partnered with Ultimed, which is one of the largest managed care, or federally qualified health centers in the country, with over 300,000 lives under management, and Children's Hospital Los Angeles, which is one of the largest safety net hospitals and specifically supporting the pediatric population of Los Angeles. Their partnership presented an opportunity to introduce a new program that they had been thinking about. The director of pediatrics approached us and said that they wanted to design a new care program, but they didn't have the technical or operational capacity to do it on their own. That program was in-home neonatal phototherapy. They knew from day one it would save them money to keep moderately jaundiced infants out of Children's Hospital NICU, but they didn't have necessarily the pathway for getting there on their own. Partnering with Mahmee allowed for the implementation of the care coordination software and then the layering of that new program design on top. Mahmee was able to facilitate a bundled capitated payment per case, meaning that every infant that qualified for the program was funded through this bundled capitated payment that included the UV equipment for in-home phototherapy, the home visitation program, and the virtual lactation support, all of which Mahmee facilitated the implementation of. We actually recruited the providers from the community to participate in the home visitation program. We worked with Ultimate and Children's Hospital to contract for the equipment needed from a large provider of UV home phototherapy equipment. And our network powers the virtual lactation support that is provided to every parent participating in this program. The effect was 95% patient compliance and PICU avoidance, as in these were the rates related to every baby that came through this program. It was a very high impact program, and it was a great experience for families to be able to go home with babies and not need to hear on the third or fourth day of life at their pediatric visit that their baby with jaundice needs to go back into PICU. Some stats on overall platform performance. Mahmee is in use in 39 different states. We have a very high patient satisfaction score. We also have very high patient engagement. This is our rate of same-day responses to messages sent through the platform. And so we're seeing, even though it can be, we've heard from many providers, it can be difficult to get a hold of their prenatal and their postpartum patients, especially their postpartum patients. We have a very high engagement rate here through the platform because of the user experience and the design on the mom's end of the platform. And then finally, high completion rates on our perinatal mood disorder screenings. So those can be set to be deployed manually by providers or automatically at different points along the prenatal and postpartum journey. An example of some of the organizations that we work with in a variety of capacities. Some organizations, again, just needed the technology to link up their own care service lines and their care programs to run more efficiently and more collaboratively. And in other cases, once that implementation happened, they came back and said, okay, well, what else can we build now on top of this? Some ideas on how we can help you. Connect your doula program or promotora program to OBGYN and pediatrics. You may have already started to make investments in this space, but are those community care providers communicating with the physician staff that are in your network? Launch and evaluate a CMS-funded home visiting program. This is a lot of the work we've done with Strong Start and Solid Start initiatives. We've also worked with First 5 grantees as well. Add maternal mental health specialists to your provider network. There are a lot of conversations now happening around mental and behavioral health, and we've seen an uptick in interest from managed Medicaid plans that already have investments in mental and behavioral health, but are looking for specialists specifically to launch programs in maternal health. Create online community for a rural patient population with support groups. Engaging and retaining patients to a program when you're not necessarily going to be seeing them that often is possible through virtual community building through the Mahmee Care Coordination platform. And finally, track the impact of digital interventions, connected devices, and patient education. You want to make sure that those implementations that you're investing in are effective, not just in tracking patient care, but also in actually boosting the kinds of behaviors we want to see that really herald and bring to life care coordination and care collaboration in maternity, which we know is absolutely essential to driving positive health outcomes. The work we've done in this space has saved lives and promoted interventions in spaces where folks didn't necessarily think that was possible within their community because of the isolation between provider groups. So we're doing this work across the country now. We'd love to do this with you, and we're interested in partnering to design better care for your patients. Thank you.